Okay, so today we're going to cover everything that you have to know about the joints or articulation. And you do have some homework and a quiz that they're up. And I don't think it's due this weekend, so it's going to be due next weekend. But then next weekend we are going to go into muscle. So everything that you should really know about joints is going to be covered today. All right, so the chapter is divided in this type of arrangements. So basically you have to know how the joints are classified, and basically we're going to see that you have two types of classifications. You can either have classification by shape, or that's the anatomical classification, or you can have classification by function. Okay, so here, first part of the chapter, how are the joints classified? And then the chapter goes into fibrous joints, cartilaginous joints, and synovial joints. So are all based on what they're made of. Okay. So here is also very important to take a very close look at synovial joints and some synovial joints that are very important for movement. And I have a couple of examples of what happens when things go wrong, when you have some kind of injury. And we are not going to cover the developmental aspects of joints. I think it's too much. So when you say joint, you also mean articulation. So the definition of that is where two or more bones meet. Okay. So the functions of joints or of these articulations is to give the skeleton mobility and also to hold the skeleton together, right? Otherwise, well, it wouldn't be a pretty sight. Okay. So here are the two classifications. One of them is functional. So that's the range of motion of the joints. And we're going to look at different types and examples of these different types of joints. And then you have also a structural classification, and always keep in mind that the structure is going to determine the function. So the structure of the joints are really going to determine on how the joints work. So here are the functional classification of the joints. So they're based on how is it that the joints are moving. Now you have these weird names. Again, sorry, not my fault, but you have to get used to them. You have to memorize them, and you have to know what they mean, right? So the first thing that you're going to come across is this synarthrosis. So those are the joints that don't move. How are you going to know that? Well, syn in this case, I try to think of it in the term of sem. So in Portuguese, sem means without. Anybody speaks Portuguese? No? All right, so we have lessons in Portuguese. Oh, biochemistry class is even more interesting on Portuguese lessons. But all right, so sem means without. So here, synarthrosis means without the movement. Okay, so without movement of these joints, of course, then the joints are not movable. And then you have the amphiarthrosis. So what is something that is amphi something? Like amphibian? It's not totally one way or another, right? So this one is moving a little bit, like more than the synarthrosis, because synarthrosis doesn't move at all, right? But is not meant for motion. So it has a little bit of movement, but not really significant movement. Okay, so those are the amphiarthrosis. And then you have the real movable joints. Those are your diarthrosis. Okay, so when you see diarthrosis here, those are your freely movable joints, also called synovial joints. So also classification here, structural classification has to do on a kind of material that binds these bones together. So bone gets together with the bone, and there's something in the middle, usually, right? So this is a material that is going to define the type of classification. So structural classifications, you have the fibrous joints. You can imagine that is a dense fibrous tissue that is present, or cartilaginous joint, you know it is in there. What about synovial joints? What's in a synovial joint? Synovial fluid, right? Those are very important mobile joints. And then you have another type of joint that is the bony joints. So these are a bit different because what join the bones is more bone tissue. Okay, so these are very specific and not very common in the body. But there are some places that we do have to know, like in your hip, when you have those three bones that fuse together, right? Oh, so here is your first question. It's not going. Starting. Okay, it's not responding. Let me wait for it to respond. This is definitely not collaborating. So, what is the answer to this question? Which of the following correctly listed the three structural types of joints? C. Everybody said C. It is C. Okay, so here is a little chart of the types of structural class of joints. So we can have fibrous, cartilaginous, or synovial. So those are the ones that I want you to keep in mind, right? So fibrous types of joints, they're going to be very much without movement. And then you have cartilaginous that has usually a bit more movement, but not as much as these other ones that are the synovial joints. So go over this chart. This is more like a summary chart. So here is another question that you're going to have for next time, right? So question is, the site where two or more bones meet is called what? Oh, this is a little tricky. Articulation, what is that? I don't know, but articulation, that's the answer you're looking for. Right, so that's articulation, the same thing as a joint. Okay. So here is the joint that doesn't move. Remember, sine is sane, not sin, right? Sane arthrosis without movement. Those are very, very strong joints, and they allow bones to really get locked into place. Now, there are several types of these joints that don't move, okay? So one of them, these are the ones we're going to look at. There's the suture. Remember what the sutures are? Yeah, in the head. All right. Then you have gum phases. What are those? On your teeth, right? So on your teeth. And then you have synchondrosis and then synostosis. Those sound a bit similar, but they have technical differences. Okay, but I'm really more interested that you really know this guy, the suture, the gum phases. You gotta absolutely know those, okay? And for synchondrosis and synostosis, we're gonna see more specific things that we can associate with. All right, so first thing, the suture, right? Suture, unmovable joint. And it has fibrous stuff between these joints, very dense connective tissue, right? So those are from interlocking joints. So if you look at the sutures and the bones and the flat bones in the head, you're going to see that first, it's not a flat line. They do have these, curves that allow for like puzzle type of connection between the bones. And also you're going to see that between the bones, you have this tissue that is dense connective tissue and short fibers, because you don't want this thing to be far apart. You want this thing to be very much attached together, okay? So these joints, they're important because during the growth development, it allows the flat bones to grow during childhood. Now, when the person goes to a more advanced age, middle age, then those sutures really are going to become bone. They're going to ossify, become really, really solid. So these types of joints, they're called synostoses. Okay, so when these two bones fuse, so those are called synostoses. Okay. And then you have this guy, syndesmosis. This is a kind of fibrous joint also. So here, the bones get together by ligaments, and these guys are not moving either, okay? So, or very, very small movement. So those ligaments, what are the ligaments? Definition of ligaments, what are they connecting? Bone to bone, right? And what connects muscle to bone? Tendons. Okay, so these guys here are ligaments. So you know that they're connecting bone to bone, okay? So here you have the example of the tibia ligament, like right here. And that is mainly for stability, okay? You don't have a lot of movement between these two bones over here. And this is on the foot, right? Let me see here. So here you have your other non-movable joint, or at least not to move much, hopefully. Those are your gum flosses. You think about gums, right? So those are the connections between your teeth and the bone that is holding the tooth. So which bone is this one right here? Everybody got that bone? Yeah, and which bone is the one here? Maxilla and mandible. So you have this type of joints here. You have these gum flosses, and the ligaments. When you see here in between, the bone, the tooth is not, totally a bone, but it's considered to be very much like a bone. So the ligament between the tooth and the bone itself is short and is dense, and is also called periodontal, like around the tooth. Right, periodontal ligament. Now, this joint doesn't really move much, but is it totally not movable, or do you have a little bit of movement? Okay, let's go for the vote. How many people think you do have a little bit of movement? Yeah, anybody use braces? Yeah, so if these joints don't have any movement at all, so braces wouldn't work, right? This is not like one solid bone. Those are two tissues here that are joined by this ligament that moves just a little bit, but not much. So here's another question, and still this thing is not working. Of the following types of joints, which type occurs only in the skull? It is A. Those are your suture joints. All right, then we start looking at cartilaginous joints. So those are going to be joined, of course, by cartilage. And let me see. Yeah, you don't have a cavity in the joint. It's not really highly movable. So you have two types of cartilaginous joints. You have synchondrosis and symphysis. So let's look at examples here. So synchondrosis, okay, so those are not going to move, okay, they're just very much stable type of joints, and it's the cartilage that is between this joint is hyaline cartilage. These are more tough type cartilage, but not as tough as fibrous cartilage. And you're going to see this type of joint when you have a growing person, a growing child, at the epiphyseal plate, okay, and it's also called the diaphysis, right? So at the epiphyseal plate, when you have bone growth, you do have this space that is made of cartilage. So technically speaking, this is a bone, that is a bone, and they are connected by something in the middle. So this epiphyseal plate is also considered a joint. But of course, this thing is not going to be moving around, otherwise it's like disaster, right? Because if you look at all the long bones that have this epiphyseal plate, if they're going to be moving, you imagine how a child would move around. That would be very odd, right? So those are non-movable joints. And another example of synchondrosis. So this is made of cartilage. Remember, this chondro, it has to do with cartilaginous tissue. Syn has to do without movement. So synchondrosis is the joint with cartilaginous tissue that doesn't have movement. Okay. So you also see here between the manubrium of the sternum and the first rib, you have this joint here that is not movable, and this is an example of this synchondrosis. And then you have the symphysis. All right, so the symphysis is made up of tougher cartilage. So symphysis is made up of the fibrocartilage. Okay, really, really tough cartilage, stronger than the hyaline cartilage. You're going to find it at the intervertebral discs, and that's for cushion. And actually, the discs, they have a specific type of architecture that the outside of the disc is made of this fibrous cartilage, but then the more inside of the disc is made of hyaline cartilage. So the inside is like the pulp of the disc is more flexible than the outside fibrocartilage shell, okay? So you find it, of course, this type of symphysis at the vertebral discs, and also at the pubic part of fusion of the pubic bones, okay? So this is called, of course, the pubic symphysis. Now, is this joint here, does this joint move or not? Well, it depends. In men, it really doesn't move because it doesn't have to. But then in women, during childbirth and pregnancy, the joint has a little bit of movement to accommodate for childbirth. Okay. So those are very strong, a little bit more flexible type of amphiarthrosis joints. Okay. So here's another slide for summary of what these joints mean. Okay. So let me see. Okay, so here is another question that, of course, we're going to get it next time because this thing is just giving up on me. So I'll just close the program so I don't have to look at it. Okay. When someone has slipped a disc of the vertebral column, which type of joint have they disrupted? Which letter? Which one is it? It is C. All right. So now the fun joints. Those are your synovial joints. Basically everything that really moves in your body, that's the synovial joint. So these bones are separated by this fluid-filled cavity, and they are all diarthrotic. They are all real movement joints. Okay. Now this is going to include all limbs and most joints of the body. Okay, and I put a link for this movie that I have borrowed from McGraw-Hill. So I put it with a link with with my YouTube channel. That if you have the link, you can watch the movie. It's very, very informative. All right. So looking here at the synovial joint. So you have these 6 distinguishing features of the synovial joints. So you have to know all of them because this is like really, really basic for joint and movement. So first thing you gotta know is that you have an articular cartilage, and that is hyaline cartilage. Now, what does that mean? This articular hyaline cartilage is going to put a protection on the bones, so the bones themselves are not gonna come into contact. Okay, so at these joints, you're never going to have bone-to-bone contact, but you are going to have this cap on the bone that is made of the hyaline cartilage, and I'm sure everybody has seen this in the lab, or at least most people eat chicken, right? Those rotisserie chicken, and you get the bone and the crust, the part of the top of the long bone of the chicken leg, that's the protective articular hyaline cartilage, right? So next time you eat a chicken leg, you're going to definitely look for that part of protective articulate cartilage, right? So this is your hyaline cartilage in both bones, and that's going to prevent direct contact or crushing of the bones. So that's your articular cartilage right there. Then you have this joint cavity that's also called your synovial cavity. And here is really like exaggerated. The cavity is not really that big, but this was drawn like that just to make sure that you understand there is a cavity in there. There is some space. But this space is actually very, very small. Like if you look at the biggest joint that you have, or one of the biggest or strongest joints that you have in your knees, right? Actually, the knee is the most complicated joint, right? You know how much synovial fluid fits in this cavity in the knee? The volume of synovial fluid. How much would you guess? Ounces, that's a lot. We measure things in milliliters.
5.
You're close, but a bit too much. 3. 1, 0, no, it is 3 milliliters, about 3 milliliters, okay? All right, so it's not really like that big, but we see the cavity is there and the synovial fluid is gonna fit in there. Then you have this capsule, okay? So this capsule here is made up of two parts. You have this external, so here you see this capsule is going to hold there. So you have the external capsule. Let's see if I have a picture for that. Well, the external capsule is this one over here, and that is made up of dense, irregular connective tissue. Does that make sense? This capsule is made of dense, irregular connective tissue. Would that make sense? What is that capsule? The dense part of the capsule. That is the part that is going to extend here to the periosteum. Okay, so that's going to be part of that periosteum part. So you can imagine this dense, irregular connective tissue that is the periosteum is going to cover this whole structure, actually covers the whole skeleton, like you know these little kids pajamas that is like one whole thing and you put the whole kid and there's one zipper. Nobody has little siblings or babies. Those are quite practical, except when you have little accidents. Then it's like the whole thing in the center gets messed up. Fine. Like a whole body suit. You know what I mean? Huh? No, onesie, the legs are out, right? So this pajamas, like the whole thing is in, even the feet are covered. So this is like a whole body suit. That's more or less how your periosteum goes in your whole body bone suit. Okay? So that is going to be part of your dense, irregular connective tissue. And it makes sense that it is irregular because when you apply movement or pressure or you start jumping around, you want this tissue to allow forces from all directions. So it's dense, irregular to cover the whole thing. So that's the outside part. Okay, so this is the external fibrous layer. Now, when you look at the internal layer, that is called your synovial membrane. So that's your inner layer. So this is loose connective tissue. Okay, and you have live cells here that they are going to secrete the synovial fluid. Okay, so this is your loose connective tissue in your inner layer of this capsule. Okay. Then, so we have 3 features. Now the 4th feature is the synovial fluid. Okay, so this is more like egg white type of consistency. It's not really liquidy and it's not really like boiled egg white. So it's more like a jelly type of gooey egg white. So this is slippery and viscous, and a lot of it consists of this sugar type of polymer that is called hyaluronic acid. Okay. Now the sugar itself, this saccharide or polysaccharide, has a lot of negative charges, which means that it associates constantly with water molecules. So that's what gives the slippery and watery characteristic to the synovial fluid. And of course, it's going to lubricate this inside portion of this structure. Okay. Now, inside the synovial fluid, you're also going to find some immune system cells Okay, so some phagocytic cells that they're going to be patrolling for some type of bacteria that would like to go in there and cause trouble to the joints. Are there bacteria that do that? Yeah, like what kind of problems the bacteria would cause? Something with the joints issue? Like arthritis. You do have some bacteria that can cause arthritis, right? So you do have, normally you have these patrolling cells, these phagocytic cells, to be looking out for bacteria. Okay. Now, fifth component of distinguishing feature, you have reinforcing ligaments, right? So there are some reinforcing ligaments. They're very important depending on the type of bones that you have. Overall, you have capsular ligaments. Those are going to hold the capsule together. Okay, those are going to be around here. So those are capsule. Okay. So you have extracapsular ligaments. So those are going to be outside of the capsule. And then you have intracapsular ligaments. They're going to be covering more of the inside of the capsule. Okay. So besides these reinforcing ligaments and the synovial fluid, you also have nerves and blood vessels that are going to be strategically placed close to these joints because they have to give nutrition and also leakage of the plasma of those blood vessels is also part of your synovial fluid. Okay. So here you have some screenshots so that you can follow with the link of the movie that I put up. Synovial fluid, articular cartilage, we just looked into that. Okay. All right, so besides that, when you look at certain big joints, you find these extra pieces of cartilage, and those are called articular discs. Another name for this is meniscus, or if you have plural, then you call menisci. Okay, so those are fibrocartilages that they are not connected to the hyaline cartilage here, and they're just like stuck in the middle of these joints, and they give a better fit to the joint, and they also stabilize the joint movement. Okay, so they give a better fit and stabilize the joint movement, and they also help to absorb the shock during the joint usage. Okay, so they're going to reduce the wear and tear at this place of this joint. So here are an example of a sideway cuts of the menisci. Besides that, you also have these other structures. They're like filled balloons. So, you have a filled balloon with water. I'm sure, like everybody had some fun in the summer, fill the balloon with water and throw at somebody. Most of the time the balloon explodes, but sometimes it doesn't, right? So this here is the balloon filled with fluid that doesn't explode, but it moves around. It has some flexibility and movement type of feature, and that is very important to reduce the friction between these joints. So you have them at shoulder joints, knee joints. You have these types of synovial joints. So here is again a little picture of the bursa. Those are sacs. Okay, these are filled with synovial fluid, and they also have the synovial membrane. Okay, and they're important for cushioning and smooth movement. And you can imagine when these bones move against each other, and you have this, especially like in the arm, you lift your arm, and you see one bone stays in place, the other bone is moving around. So this sac in the middle is really moving. The membrane goes around in order to facilitate that type of movement. Now, besides here at the joint itself, you also have these bursa sheets that go around tendons, right? So the tendon is going to connect two bones. No, it's going to connect the muscle to the bone, right? The ligament is two bones, right? So this bursa here, look, it just flaps around like a hot dog bread, right? Around the tendon. Let's say that's a hot dog, okay? So it also helps to lessen the tension and the friction. Besides all that, so here you have a bursa that can, you have a little arrow for movement of going around. Besides all that, you have fat pads that are not showing here, but fat pads are going to be filling up the spaces that nothing else is filling up. So we're going to just put some fat pads here. Okay, so here is a fat pad. When you have some opening, here is more fat pad. Is that going to interfere with the movement of the joint? No, it's actually going to cushion it, and it's going to also help to absorb shock and allow a smooth movement at the joints. Go on. So joints need to be stabilized, right? So you have several stabilization factors or stabilizing factors at the joints. First thing that you see that is the most important stabilizing factor is muscle tendons. Okay, so those are giving very good structural support or stabilization to the joints. And if you have fit muscles, you're going to also have fit muscle tendons. Now, the shape of the joint itself is not really that important for stabilization, as well as ligament between the bones. Those are also not counted as very important for joint stabilization. So what's really, really important is tendons, is the muscle tendons that are going to stabilize the joint. Looking at this fun range of motion. So you can imagine that when you have a joint that's going to move, right, you have to have some origin of this movement for the bone. So the origin of the movement is the bone that doesn't move, and then the insertion is the attachment to the bone that is going to move. So if I keep my arm like this and I do like this, which one is the origin? The humerus or the brachii? The other one. The part is moving is the insertion, and the origin is the humerus. Okay. Now, range of motions. You have this non-axial that is just a slipping type of movement. It doesn't go around axis of any kind. Okay, those like sliding type of movement. Then you have uniaxial, is only movement in one direction, like your elbow. It just goes one way, right? Uniaxial. Then you have biaxial. That type of movement sometimes is a little bit hard to visualize, but if you just imagine your phalanges when they're getting together with the carpals, right? You have carpals here, and then you have phalanges that go up here. When you have at the hand, you can go with the hand like this, and you can also spread it apart. So this is type of biaxial movement. Okay. And then you have the multi-axial. Which one would be example like a multi-axial movement? Like your arm goes all around, right? That's multi-axial. Okay, so you have three types of movement. Gliding, as we mentioned, this can be non-angular. And then the angular movements, you have to have more specific types of angular movements. I'm gonna go through all of those. Flexion, extension, hyperextension, abduction, adduction. Yeah, those names are gonna drive you crazy because they did drive me crazy. Then circumduction, and then you have rotation. So let's look at pictures and see what they mean. Gliding movement. So one flat bone surface glides over another flat bone surface. So this is gonna be intercarpal joints, intertarsal. So here is your hands, and those are your feet joint, and some articulation at your vertebra, right? So here you have gliding movement over here. You're just sliding on the bone on top of each other. Now we have your angular movements, right? So you have flexion. That is going to be a movement is going to decrease the angle of the two bones at the joint, right? So when you flex, everybody knows flex your muscle, right? You flex, here is your 180 degrees angle. When you flex your muscle, you decrease that angle, right? What angle is this? 90. What angle is this? 45, right? Okay, so this flexing. Extension, that's the opposite. You have a bone in a certain place and you're going to increase up to 180 degrees. So that's your extension. So that's simple, right? Flexion, extension. Hyperextension, what is that? Can you do that with your arm? Hopefully not. Unless you have a lot more fibrous stuff, what people call double jointed. It's not double jointed, it's just extra, flexible. No, you cannot do that. Don't try to do that with your arm. Okay. So hyperextension is, for example, when you have when you're moving your head or your neck, you can do a flexion here, extension here to 180. But then if you look up to the ceiling, that's hyperextension. Okay. Actually, it's funny. I just saw this question in a test bank that says, when you extend your head all the way to look up at the ceiling to the point that it hurts, what do you call that? And I'll say that's a dumb head movement, because why would you do that? I mean, really. No. But anyway, hyperextension is past 180 degrees. Can you do that with your back? Yeah, haven't you watched that Shin Yun dancers? I mean, they totally hyperextend to the extreme, right? Have you seen those exercises, what these dancers do? It's unbelievable. They don't seem human. Amazing, right? They do these exercise that they fold in half like a paper clip. It's like, oh my God, that's like a total super hyper extension. Right? But yeah, if you stand here and you can say, if you go forward, what do you call that? Flexion, and then coming back up, that is extension. And then if I go back, that's the hyperextension, because I'm not in a 180 degrees plane, right? So you gotta know that. All right. Oh, so here I have the little picture of the movement. I didn't actually have to do it. All right. So these guys here, abduction. You take it away. When you abduct something or someone, you take it away. Away from the body, abduction. Closer to the body is adduction. Don't get those terms confused, please. Just remember, abduction is to take away. All right. Circumduction, what's that? That. You try to put that into words, it's just easier to do that. Right? Circumduction, right there, in circles. All right. Cone, oh, you describe a cone in space. There you go. These people have such imagination. All right. Rotation, you move the thing on the x-axis. So saying no, that's rotation. So yes, you have this medial and lateral rotation. As long as you know rotation, I'm happy. Okay. This one we have seen before, the supination and the pronation, right? So that's just a little review. This is a new one because the foot gets its own term. You have this dorsiflexion and then plantar flexion, right? Dorsiflexion and plantar flexion. I never remember what the dorsiflexion is, but I remember what the plantar flexion is. That is pointing your toes like you're gonna dance on those what do you call those? Pointed shoes, like ballet, right? Anybody took ballet here? No? You did? Hey, good. It's very, very unusual to find, a guy taking ballet classes, especially in this country, but it's very difficult. It's very difficult, right? I tried to take ballet before, but I was always overweight, so I never qualified for the class. So I took some jazz. Okay. But plantar flexion, you point the toes down. So the dorsiflexion has to be the other one. You just bring the toes up. Okay. This inversion and eversion. Just memorize the motion of the foot here, right? Inversion, you're bringing it towards the body, towards the midline. Eversion, you're taking it out, in and out. Okay. This is a cool one, protraction and retraction. That has to do with your jaw, right? So if you do a protraction, you put it forward. You do a retraction, you put your front teeth forward, right? So just out and in, pro to the front, retraction to the back. All right. Then you have, of course, elevation and depression. That is your chewing motion, right? Bite on something, elevation and depression. This opposition, the thumb gets its own term for opposition because the thumb is very important. We have oppositional thumb, right? So because the thumb can touch the other fingers, that's the movement of opposition. Can your other fingers do that? You can try. It might look a bit strange, but no, only the thumb, right? Only the thumb can do that. All right, so here's a little table with the summary of what these movements are. Definition, okay? So here, types of joints. So you gotta know them all, right? 6 types, and those are all red and bold, so they're important. So they are put here on basis of more motion to less motion. So first you have your ball and socket joint, and again, this, please take a look and really pay attention to that supplemental video that I put up because they do such a good job explaining it, right? So here we have a multi-axial movement, multi-axial ball and socket joint. It can move up, it can go around, it can go around, you know, it makes circles, cones. There's your multi-axial type of joint. And you can even do this rotation on your multi-axial type of joint. That is the ball and socket. Now, just a point here that your shoulders, right, your ball and socket at the humerus, they have a lot more flexibility than at the femur, right? So more flexibility also means less stability. So it's easier to get your humerus out of the socket than it is to get the femurs out of the socket. Thank goodness, right? Okay, so the next type of movement that you have here, type of joint, is the condyloid joint. And this is a type of joint that allows you for 2 axes of movement. So that would be like, the bending and the stretching, right? So in 2 forms, this is biaxial movement. So here's the shape for your condyloid joint. And where do you find those joints? On your hands, right? These are metacarpals, and here are your phalanges. You have in your hands, and you also have in your feet, although you don't use those that much, right? But you do have it there. Then here you have your saddle joints, and that is a specific joint for your thumb, right? So that is a joint that also allows biaxial movement, and that allows for that oppositional type of movement for the thumb. Then you have this plane joint, so just joints that are sliding on each other, okay? Non-axial movement, they just slide on each other. Planar joint. Then you have this cool hinge joint, like a door hinge, right? Or like your elbow. And that only allows one type of movement, right? And that's very, very typical for the knees and the elbows, right? One type of movement, uniaxial movement. And lastly, here you have your pivot joint. And this, I hope you have seen this in the lab. That is like example of a connection of the radius. Here, when you have to the humerus is not showing here. So here is radius to ulna, and then you have this other connection is not showing. Anyway, it's here, the humerus is right there. So this type of joint, the radius is just going to go around on its own axis, so it's a uniaxial type of movement. It just rotates on its axis. Okay. And here are some joints that are very important to know. Temporal mandibular joint. This is what I like about the joints. If you even have no clue where they are, if you just read them and remember the name of the bones, then you should know or figure out where these joints are. Temporal is telling you is at the temporal bone. Mandibular, well, is at the mandible. So temporal mandibular joint, you should be able to locate it, right, between the temporal bone and the mandible. Okay. All right, so you have a couple of types of movements of the temporomandibular joint, or acronym TMJ. You have hinge, that's going to allow for depression, and elevation, and then you have gliding, right? So you cannot do like protraction and retraction, but you can also go side to side. So it's very, very movable joint. Is it easier to get this joint out of place, relatively speaking? Yeah, it has a lot of movement. It doesn't have a lot of stability, right? All right, so here is your temporomandibular movement. Then this is another very, very important joint. Glenohumeral, you know the humeral is the humerus, right? So this is your important ball and socket joint at the head of the humerus. Okay, let me see. So we don't have that much stability because we do have a lot of movement. Let's see. So there are some ligaments that are important for keeping your glenohumeral joint stable, right? So you have this coracohumeral ligament, and yeah, this doesn't even sound English or like a word, right? But here it says humeral and it says ligament. So you should remember that this has to do with this ball and socket joint and is there for added stability. Here this tendon, remember tendons are important for stability of joints. You have this tendon that is going to connect the biceps to here to this part of the humerus. So this is a tendon, okay? This is going to the biceps muscle, and here is going to be connected to the head of the humerus. This tendon is very important for the stability of the joint. Okay, let's see what is also important here. A lot of details here. All right, so those parts I would say are the most important. Now looking at the elbow joint, so you have, again, this is type of hinge joint. So it goes only in one way, one unilateral movement. Let's see. Well, we looked at the bones before, so you remember that this has to do very much with the ulna. And which one is this bone right here? The humerus. Yeah, that's the joint that is important here for the hinge. Important ligaments that keep the elbow joint in place: the annular ligament, okay, and you have this radial collateral ligament. And you also have the ulnar collateral ligament. So there are three ligaments that are important for stabilization of your elbow: annular, radial, and the ulnar. Doesn't show here, but it shows there. So the ulnar ligament is on the other side of the elbow, and these three ligaments they're very much important for stabilization of the joint. Okay. All right, now looking at the coxal or your hip ball and socket joint. You remember this structure here, the acetabulos, right? So you have here an extra thing connected to the acetabulum that is called the labrum, and this is made of this like rim of the fibrocartilage, and that is important for also for covering the head of the femur for stabilization of that joint. As you see here, you have several ligaments that are going to stabilize the hip bone to the femur, because those are very, very big bones, and the amount of weight that they sustain and the amount of movement, it really calls for a lot of support, right? So you do have ligaments here. Remember, ligaments are going to attach bone to bone. So we have iliofemoral, and there's also telling you where this ligament is found. You have your ilium bone. Iliofemoral is between the ilium and the femur. Ischiofemoral, then that should be very obvious too, because you have ischium bone there. And let me see what other ligament. Yeah, these two ligaments are very important, attached directly to the femur. And just looking at the name of the ligaments, you should definitely figure out where they are located. So looking from the other side, Okay, so iliofemoral ligament, that's important for stabilization. And this one right here, see this pubis, the pubis bone, right? So here you have the pubofemoral ligament. So if you see hip bones with recognizable names and their ligaments, you should be able to figure out where they are and what they're doing. Okay. Now, coming to the very interesting knee joint. Okay. So you have several things going on here. You have the femoral patellar joint. Where are you going to find that? Like between the femur and the patella. So here's a femoral or patellar joint, kind of tongue twister kind of thing, right? Now, you have lateral and medial tibiofemoral joints. So you have a lot of joints going on here. What you have to know here, you know that just like with other synovial joints, you have here your hyaline cartilage for the joint protection, right, at the two sides. You have here your bursa, right? So you have also tendon for some big bone, big muscles, right? So tendon for muscle, and so this is for the quadriceps. Here you have your patella, and remember how the patella originates? Intramembranous bone that develops after birth. Actually develops when the child starts to walk. Babies are not born with patella, right? So here's a patella bone right there. So you have several bursa. You see these sacs everywhere. It's like bursa everywhere. Why do you need so many of these bursa? It's a site that can be very often insulted, right? You can fall on your knees. You can get stuff that gets thrown at your knees, right? All sort of things can happen. It's very easy to injure your knee. So you have, all this bursa, and then you have see the fat pads right there. Is whatever you don't have other tissue, you put fat in there. So it's another cushion right there. Okay. So what is important to know here? Okay. Tension. Okay, let me see here. Okay, so you have those meniscus or menisci that is also made of the hyaline cartilage, those for shock absorption, right, and movement. And then you have all these ligaments that are really, really important for knee stability and movement. Anterior cruciate ligament. Have you heard of this guy? Yeah, that's your ACL. So when people have sports injury, they say, oh, I tear the ACL. This is the ligament that they need, okay? So this is the front of the knee. So this is your anterior cruciate ligament. And they are called cruciate because they go across the knee for support, okay? So you also have, let me see here, posterior cruciate ligament. Is not teared as often as your ACL, but sometimes I guess you can hear about your PCL ligament. Right, so this one is the big one that is very often site of injury. So here more on the knee joints. Okay, so you have stabilizing ligaments. Now, important ligaments to know: fibular and tibial. Remember the fibula and tibula, right? Fibula and tibial. Collateral ligaments. So here are fibular collateral ligaments right here. So that's the fibula. And you should have the tibial right there, tibial collateral ligament. It goes all across, okay, for the knee. Oblique, somebody says this word. Yeah, that's another ligament. And then arcuate, some word that I cannot pronounce, also ligament, okay. So here are the oblique, okay. And okay, fibular and arcuate, that's the other one here. So those are important for all this stabilization of the knee. Okay. So we talk about that, the anterior cruciate ligament, your ACL, and your posterior cruciate ligament. And let me see. So these are really not inside of the capsule of the knee. So they are outside of the synovial cavity, but they are they are inside of the joint, but outside of the synovial cavity. In the synovial cavity, you're only going to have synovial fluid. But you should definitely know where those ligaments are. Oh, sorry, that boring. Let me put something more interesting here. Like, yeah, people are like, yawn. So let's wake up now. Knee injuries. Anybody had a knee injury before? Yeah, yeah. I got a few, and I still have some. So the knees are sites that are going to really absorb a lot of shock. If you fall, on the floor, fall on your knees, you're going to get all the weight of the rest of your body, right on the knees. It's vulnerable to horizontal blows, lateral blows, extended knee type of injury, and easier thing to damage in the knee is the collateral ligaments, especially the cruciate ligaments, right? Your ACL is easier place to damage. So here the patella would be, here is not showing the patella, but here is showing your tibial collateral ligament. They can be torn. Now when ligaments get torn, if they're not totally ruptured, then they will heal slowly, because you know that these are sites that doesn't have really a lot of circulation of blood, right? So these ligaments, they can, if it is just a little bit of collagen that was torn, like a sprained ankle, a sprained ligament, then the collagen will rebuild itself. But if you have the tissue that has like a total tear, then you really need surgery, because the thing is not going to build itself back. Okay, you really need surgery to put the thing back together. And here are some examples of common knees injuries, right? Remember, in your knee you have several bursa. So when the bursa gets inflamed, you can get bursitis. Also on your elbow, when the elbow gets inflamed, you can get bursitis. Anybody plays tennis? Yeah, tennis elbow, that's bursitis, and it hurts, and then you can't play tennis for some time, and that's upsetting, right? Now, sometimes when you fall on your knees, you can get this bursitis and a lot of bruising. So yeah, that's my knee right there with a huge blobbing bursitis after a skating accident. And here is after another skating accident with a lot of bruises in the knees. And yeah, it hurts. Okay. So bruises happen. Knee injury happens, right? So more common types of injuries. You have sprains, right? So this is when the ligament gets very much stretched or torn. Now sprains usually just recover on their own, because what you're tearing here is really the collagen fibers, and those are going to be rebuilt. Okay. They heal, they slowly repair, and of course it's going to be very slowly because you have poor vascularization at this site. Now, if you do cut it completely, right, then you have no choice, but you do have to go for surgery, because the ends have to be sewn back together, stitched back together. Or sometimes you can replace those ligaments with grafts or artificial ligaments. And of course, you're going to have to immobilize the area for quite some time until it recovers. Anybody had like sprained ankle? That's another very common tennis injury. Yeah, and I can, but it's very common. If you practice any kind of sports, it's very common for that to happen. Okay, then you have these dislocations, also called luxations. Okay, so the bones here come out of alignment, and sometimes they come out of the socket. So that is also, doesn't go by itself. You have also sprains, and you have a lot of inflammation. Of course, the thing hurts, right? And you're going to have difficulty moving the joint, of course, because it's out of place, right? So you have to actually put the bone back in place before, and allow time to heal and inflammation to go down. Okay, so this is very common in contact sports. And sometimes if you have weak ligaments or weak tendons, you can have these types of dislocation just by nearly any type of activity. Like a friend of my son was driving, and he went a bit too fast on a speed bump, you know what I mean? And he was holding the steering wheel, and when he realized there was a speed bump right there, he couldn't really slow down, and his whole arm came out of the socket. And of course, that kind of thing has to happen on a Saturday night, like around 3 a.m., you know. So yeah, so I took him to the ER and he's like holding his arm. Oh yeah, and they had to, you know, of course, put some anesthetic and just put the ball back in the socket. Right? I imagine that would be very painful without anesthesia. All right. So inflammatory process, you have bursitis, which I just mentioned. You also have inflammation of the tendons, it's tendonitis. You know, when you have itis, that is inflammation, right? So bursitis, tendonitis, very, very painful. Plantar fasciitis. And sometimes you have to go for joint replacement because there are some people who totally abuse their joints, like their knee joints, you know, like soccer players and these types of very competitive people, and they end up having to replace the joint. And here in this case, it's a hip replacement, right? So they use titanium and plastic to replace the original joint. This is very, very common type of surgery. So here's an X-ray showing a knee replacement. Okay. Oh, and then other problems that can happen with joints, like arthritis. Okay, so not all arthritis. Look at this. This is rheumatoid arthritis. It's very deforming, but you have a lot of types of arthritis out there. Over 100 different types of arthritis or inflammation of the joints. Okay. So these symptoms are painful, stiffness, pain and swelling of the joint. Some of them are caused by bacteria. So when arthritis is caused by bacteria, you treat with a long period of antibiotics. And these are acute forms of arthritis. And then you have chronic forms of arthritis, and in case osteoarthritis and rheumatoid arthritis. And interestingly, you also have this type of gouty arthritis. Have you heard of gout? No, you haven't heard of gout? You didn't take immunology and stuff like that? Biochemistry? Yeah. So gout is the deposit of crystals, uric acid crystal, at the joint that is further away in the body. You know where that is? No, further. That's at your big toe, specifically at your big toe. Don't ask me why. Okay. So what happens, you have these crystals that they just stay there, crystallize right at the big toe joint and cause a lot of inflammation and a lot of pain. So people who have gout, they have described this as being like the toe is on fire because it feels like it's burning, it's so much pain. Like not even the sheets, like usually happens, you know, gout attacks will happen at night for some reason. And like the sheets of the bed sheets are too painful to be on top of the toe. So you have to really, you know, treat it with painkillers and anti-inflammatories. And there is a specific drug that helps to dissolve the uric acid. Okay. Now, do you know the causes of gout? Yeah? No? No. That helps, but not quite. But if you have excessive alcohol consumption at the all-you-can-eat barbecue, then it's a more likely situation. Because meat can cause gout. Or in like people who are like, they call this carnivore diet, I'm not sure if they're going to have a lot of problem with gout, right? Because as we're going to see when you get to the muscle cells have a lot of nuclei. And gout is caused by metabolism of nucleic acids, specifically of purines. So if you consume a lot of that stuff, then it's going to accumulate, and that can cause gout. It used to be called the rich man disease in the Middle Ages, because they were the only ones who could afford the meat in the first place. Right? Okay, so here, rheumatoid arthritis usually occurs later in life. Rheumatoid arthritis is autoimmune disease. So your body makes antibodies that attack the joints. So, and not only attack, but also deform the joints. Okay. So briefly talk about gout. And you also have Lyme disease that can cause presence of bacteria at the joints and can cause arthritis. So this is another type of problems that are derived from a bacterial infection. Gout is not. Gout is because of too much meat consumption and tendency to develop it, and not drinking a lot of water. So if you drink alcohol on top of that and you get more dehydrated because alcohol dehydrates, then most likely you can get a gout attack.